that's great. But I'm Diana Lindsay. For those of you that I haven't met yet, I'm the Ambassador Chair with the Round Rock Chamber. And on behalf of the Round Rock Chamber, we are thrilled that you guys are here. We're so excited to have you in Round Rock / Austin. I know we're on the line. And just delighted to celebrate with you today. Looking forward to hearing more about Aspen. So what I'm learning, guys, is Aspen University has a huge nursing component. Not all that they do, but over 10,000 nursing students online. So a really big piece of the puzzle with that. And just really excited about introducing you to that. Ambassadors, if you guys will raise your hand real quick, I'll acknowledge you guys. So this is the ambassador team. They are basically the welcoming arm or the face of the chamber. Okay. We go out and welcome all the new businesses, help with the ribbon cuttings, those kind of things. We're that face of the chamber in the community. We've actually placed our cards here in this portfolio as just a sign to you that says we're a phone call away and we're welcoming you.
Thank you.
Excited about having you guys here. But I'd like to introduce you guys to Dr. Rhonda Winiger. She is the program director here. She's going to be the boots on the ground here that helps with everything. And then also Dr. Ann McNamara, who is from Arizona, Phoenix area, right? And she's their chief nursing officer over the whole shebang. And I'm not going to get any more in the weeds because I'll mess up some of the details. I'm just going to introduce Dr. McNamara and let you talk to us a little bit about what you'd like to.
Well, first of all, I'm excited that you're all here, and if you want to give us, your time, we will give you our story. So we're excited to open in Austin. So as was shared, Aspen University has been around for a number of years, but for many, many years it was just primarily an online nursing school. So it was all post-licensure. So all registered nurses have a license. So, but all we did then was RN, associate degree nurses getting their BSN, all online. Baccalaureate nurses getting their masters, they could do that all online. We now have a doctorate of nursing practice, and again, that's all online with a focus on leadership. So those are individuals that might find themselves working in hospitals or healthcare facilities in an administrative role, in a leadership role of some sort. So in 2017, I was actually brought on by our CEO to start a pre-licensure program. Okay, pre-licensure, right?
Yes.
Right. one of our students is here. So, and so those are individuals who want to become nurses. And so then what we do is we take them from 0 to 100 to be able to pass their nursing boards. So our program is designed that the very first year, which we call pre-professional nursing, and that's all your sciences, your anatomy and physiology. We have a cultural diversity course, we have sociology, English, math, the things you would expect in an undergraduate degree, that those all get done online. Then there's a competitive process for students to then get into what we call the core. So the core is what our student here is participating in, and that's when it's like we hit the ground running. It's like boom. And so students are taking health assessment, right? I'm going to check you out head to toe. They're learning all about pharmacology. I mean, as you know, there's thousands of medications out there. So we have to teach them the core of how to understand pharmacology and make sure that they keep you well. Then all the things that nurses do to patients, which we won't go into, but we have to teach them that, and we call that fundamental skills. So those fundamental skills, everything from taking a blood pressure to putting in an NG tube. It gets nasty because we're taught, but we have to learn how to do it to get people, wound care, all of that. And then after all of that is done, then our students move into the community and go into clinical settings. So they'll go into mental health and do mental health rotations in the community. They'll go into community health, do community rotations in the community. Adult health, so hospitals primarily. And we have kind of 2 sets of courses for what we call adult health. So the first is just kind of, I live with a chronic illness, you need to understand what's the deviation from normal, okay, to know that. And then we have 2 courses on what we call complex care. And that is more into your septic shock, people are, you know, burns, major accidents, things like that. And then we weave into all of that clinical work courses like professional ethics, okay? Ethical dilemmas, what does that look like? How do you manage that? We weave in healthcare informatics so that, because we know, again, technology is going through the roof. So our students have to be ready to know. And when they graduate, we graduate a beginning nurse. We don't tell them they can go out and do surgery. They're not going to go out and run the hospital, although they may think they can after they get through this program. But the truth is they're a beginning nurse. And really it takes 2 to 4 years to move then to an advanced beginner, then more, you know, kind of up in the ranks, depending on, because there's over 3,000 different areas that nurses can choose from. Everything from school nursing, cruise nursing, okay? Took a cruise before COVID, and there was a whole group of nurses that were on there, and they loved it. But you know, everything from, of course, the usual, what you think, and all of the nurses were celebrated during COVID, primarily in the hospitals and the emergency rooms. And that's usually where new grads start. They start in the hospital, but then can also move into the community, public health. They can move into hospice care, end-of-life care, all of those things. So there's actually over 3,000 choices, which is, that's why, I mean, I love it, because I've been in it forever. And I'm gonna say about every 6 to 8 years, I've gone, oh, I think I need some more education, boom, boom. Then my jobs would change. Then I go back again, more education, boom, boom. And I go up again, and I'm sure your pathway's probably been similar around it in that same way. So we're excited to open this campus. We're excited to become part of this community. Our nursing students wear really fabulous blue scrubs. And so it makes me happy when I see the blue scrubs, because we know those are our students. And before you know it, you might be seeing them in your doctor's office or in the surgical suite or someplace else. And then you'll know they're from Aspen University. So thank you for coming today, and thank you for giving us such a warm welcome.